Good morning. My name is James Danger. This is a video on breaking news in IVF from articles published in the press somewhere after the 1st of December. In this particular issue, episode number 6, I'd like to talk about four topics that broke in the news in the last couple of days. One was a failure to treat male infertility. The second one was to use the UK transgender and non-binary use of fertility services. The third one was a very quick note on the costing of IVF. And the last one is the UK couples using legal loopholes to use polygenic testing on embryos. I say just very quickly. The first one came in The Guardian about 3 or 4 weeks ago, and the failure to diagnose treatable male infertility leading to unnecessary IVF, the experts say. So they argue that 50% of all infertile cases has some aspect of male infertility. It's poorly understood amongst GPs and means it's often untreated. It goes on to article goes on to say the many causes of male infertility are treatable. One of the most common, varicocele, where a dilated vein in the scrotum that increases testicular temperature and damaging sperm, can be treated easily through surgery, while lifestyle adjustments and supplements can also help. And in such cases, a couple may not need IVF, they just may need the husband's surgery. But there was a lack of awareness of male infertility in the general population, which can affect between 5 to 10% of all males in the UK. You're also saying that most couples struggling to conceive were seen by gynecologists who predominantly specialise in women's health, and that most regions only had 1 or 2 dedicated andrologists specialising in men's health. Historically, fertility has been seen as a woman's health issue. It was always considered as the barren woman because men think they're fertile if they're producing sperm, said Dr. Carroll. Men should be considered on parity with women. Men should also do more rigorous testing, more lifestyle medical testing, and we should do physical examination of testes, not just do a semen analysis. And there is a growing momentum that a male's reproductive health is a good hubbing of general health of the male, and more attention should be given to male health. The second one occurred in BioNews, which I thought was of interest. How UK transgender and non-binary people are building families through fertility treatments, published late November. In the same week that King Charles III dedicated the UK's first national memorial honouring LGBTQ plus members in the armed forces at the National Memorial Arboretum, our long-term single-centre study reported how transgender and non-binary people are accessing reproductive technologies in the UK. The study found that TBN individuals were undertaking fertility treatment in a range of relationships. Those freezing their eggs most often did so without a partner, whereas those looking to conceive attended the clinic with mostly cisgender partners and a minority with other TBN individuals. Importantly, the findings point to cryopreservation as a pivotal in the fertility journeys for many TBN individuals, affording them the opportunity to achieve biological relatedness in their future children. Egg freezing was a popular option, including those who had previously used testosterone. Our findings show commonalities with those from other studies in the US and Spain, which have also indicated that TBN individuals use an array of fertility services to build their family, suggesting similarities in family-making practices of the trans community across borders. This new study also sits alongside an earlier UK study where we describe family creation by a couple in which both partners were transgender, whose combined use of fertility treatment and surrogacy within the UK legal framework led to the birth of 2 healthy children. And the comment here is that clinics need to increase their counselling and their data management and their approach to making sure that they can treat TBN individuals if and when they come through their clinic. They need to be prepared for this. Thirdly, just a very quick mention. This was a thing that came through Inside Reproductive Health, which is an interesting podcast website. And this one is based on an article published in Journal of Assisted Reproductive and Genetics, looking at how you can actually cost IVF services. But they make a point. The co-author of the groundbreaking paper in JARG on activity-based costing in IVF said, unpack the numbers behind it. They discuss why an IVF cycle isn't a single service but a set of unique work orders, how retrieval volumes ICSI and PGT each reshape the cost per cycle immensely, the dramatic efficiency differences between labs performing between 200 and 4,000 cycles a year is self-evident, and there's a growing impact of managed care on the margins. And then they go on to promote their business, how the Aurora business from Conceivable Life Sciences, can they help? So I'm not that interested in it. But this is actually a very good article, and it's worthwhile browsers opening it and reading. There is the link here. You want to copy it down. And the last news item, which I thought I have already indicated in another website, another YouTube video made on polygenic testing. This is the start of something which is really quite problematic for IVF clinics. So that is, the UK IVF couples use legal loopholes to rank embryos based on potential IQ, height, and health. And British fertility clinics raise scientific and ethical objections over patients sending embryos genetic data abroad for analysis. This is also an article in The Guardian, which I think actually is quite a good paper. So the article says, couples undergoing IVF in the UK are exploiting an apparent legal loophole to rank their embryos based on genetic predictions of IQ, height, weight, and other aspects, The Guardian has learned. The controversial screening technique, which scores embryos based on their DNA, what's called polygenic testing, is not permitted at UK, nor is it in many other countries, including Australia, where embryos are tested, which scores embryos based on their DNA, is not permitted in UK fertility clinics, and critics have raised scientific and ethical objections, saying the method was unproven. So much in IVF is unproven. But under data protection laws, patients can, and in some cases have, demanded their embryos' raw genetic data collected when they're having PGT testing done be sent abroad for analysis in an effort to have smarter, healthier children. One US company, Heresight, which charges an amazingly exorbitant cost of $50,000, £37,000. That's almost 70,000 Australian dollars to test an unlimited number of embryos, confirmed that it had already worked with couples undergoing IVF at clinics in the UK. There's no suggestion that Heresight is in breach of any regulations. It's just the cost. The cost of it is just immense. In the UK, as I'm sure in other clinics like Australia, tests performed on embryos are legally restricted to a list of serious health conditions such as Huntington's, sickle cell disease, and cystic fibrosis. Clinics cannot perform polygenic screening for the purpose of embryo selection. HIFA also says that a clinician should not be guided by a patient onto which embryo to use based on the patient's knowledge of its scores. Peter Thompson, the chief executive of HIFA, said the polygenic testing was unlawful for use in the UK, where he cites a law saying licensed clinics in the UK are responsible for selecting embryos based on what is permitted in the HIFA Act, and therefore should not offer such testing or subsequent treatment, he said. However, there is nothing to stop a UK-based couple seeking such testing and indeed treatment overseas, but a UK licensed clinic should not then make decisions on what embryo to put back using that information. Some have questioned, though, whether the HIFA's position is enforceable. Hickman basically said the clinic would not generally block a couple's request that a particular embryo is transferred before another, provided there was no conflict with medical safety. If the patient wanted to have an embryo number 1 transferred and the clinic said, no, we want embryo number 3, I cannot think if this were to go to a judge, they would say, no, you have to have embryo transfer number 3 transferred. Heresight has built its algorithms on using large genetic databases, including UK Biobank, and has published a scientific basis for its predictions. You can see my previous YouTube video on polygenic testing. However, using polygenic scores in the context of embryo selection remains contentious, and the European Society of Genetics has condemned the technique as unproven and unethical. There are also broader ethical concerns, including the potential for a stratified society where wealthy people pay to select the embryos they prefer, and the prospect of normalising a belief that some individuals are genetically superior. Professor Angus Clark, a clinical geneticist at Cardiff University, said, "These companies are dealing in murky science at an emotionally fraught context." He said some parents may find it hard to resist the promise of selecting the best child possible rather than any old child. And as I said in my own YouTube video, this, I think, is the canary in the coal mine, the first leak of a dam. Increasingly, couples are not interested in what doctors say. They only want what they want. And if they think they can get a healthier child or a safer child, particularly if they have a history in their family of some condition like breast cancer, they will be flooding to this, particularly if they've already paid to have the embryos genetically tested for euploidy in PGT. I think clinics are going to struggle to the real problem here is that when couples who are not infertile come through and have IVF PGT, then have the material tested, that is the danger that's only a couple of years away. So that's enough news for the day. Just by way of a welcome and disclaimer, my name's James Danger. I'm an embryologist with more 50 years experience, and the content of this video is not, I have to say that I'm not a medical person, and this information on the video is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice you receive. If you like what you're doing, click subscribe. If you like my efforts, you can always donate some money to my GoFundMe page to keep this website going. And whatever you do, please leave a comment and express a like. And just a quick word from my own sponsor, which is my own company, FertAid, that provides an online EQA program in training, EQA and training program in andrology and embryology. And I think that my lot is the end for the week. I'd like to thank you for listening to this video. IVF is a personal journey that involves the action of many. It helps to understand that all aspects of that journey, and I hope this information may be of value. And at that point in time, I will say that's enough for today.